All right, the White House revealing steps they are taking to combat the Ebola outbreak in Central Africa, including setting up a health facility in Kenya to receive Americans exposed to the virus. Secretary of State Marco Rubio speaking on these precautions during yesterday's cabinet meeting.
Our number one obligation, we're involved in foreign policy, but even our foreign policy, the number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States. Multiple agencies involved here are also very involved in tracking people just to make sure that nobody comes into this country that has Ebola and creates a problem for us. And we feel like we've got good efforts in place to do that, and Americans should feel assured that the president and his administration is doing everything we can to protect them on that front.
Family and medicine physician Dr. Jessica Gray joins me now. Dr. Gray, thank you so much for being with us this morning. Can we keep Ebola out of this country?
So no country can actually guarantee zero imported cases of Ebola, and that's just the plain fact about it. But we have done things back in the 2014 outbreak in West Africa that actually kept the infection from spreading into the United States. So there's not a for sure way we can 100% keep it out, but we have been able to practice some effective methods to keep it out in the past outbreak, which was very important. And we're trying to implement some of those similar things now as well.
All right. So, Doctor, the New York-based International Rescue Committee said on Tuesday that the Ebola outbreak in the Democratic Republic of Congo and Uganda is now spreading faster than responders can contain it. And risks are becoming what could be the deadliest on record. What is different about this strain?
So there are multiple strains of Ebola, and this strain is the one that's a little bit more rare. It's not new, though. We've actually known about this strain since 2007. It was identified first in Uganda. It is called the Bundabujo strain of Ebola. The other one is that we may have known about a little more is the Zaire strain. The problem is right now that we do not have an effective vaccine or antibody treatment the way we do for the Zaire strains. So this is a more rare, potentially the same amount of lethality. We're looking at 25 to 50% lethality with this infection, and it doesn't have some of the therapies that we are used to using with the other strain.
Tell us what happens to somebody when they contract Ebola.
So the very first symptoms of Ebola are pretty similar to things like an influenza infection. You're going to have things like fever, severe GI symptoms. The problem is that you don't really know that you're having Ebola until the symptoms get much worse necessarily, unless you've had that direct exposure. Everyone's always concerned about getting this, traveling on an airplane or something like that. You're not going to get it that way. It's got to be direct exposure to the bodily fluids of someone who's had it. The biggest concern is in the end, without supportive care, people have multi-system organ failure.
Yeah. And Dr. Gray, finally here, the White House said recently that they are setting up a facility in Kenya to treat Americans who have been exposed to Ebola. Usually those Americans would be sent back to the United States, but this time it's being treated in Kenya. Tell us about this change and if you think this is a good idea.
So I could really only comment that, there's more of a policy issue there. I can really only comment on the medical side of it. Really, the biggest thing is that we need to make sure patients who contract Ebola need to have the highest level of care. They need to be given care in an ICU setting. And so if we are going to provide this care, we need to make sure that it is at the highest level possible. Traditionally, we would think that the United States has the highest level possible. So if they're able to create the high level of care and the intensive support care that's needed in this Kenyan area for care, then perhaps it can be a good opportunity to provide care quickly to these individuals affected.
Yeah, time is of the essence here, I imagine. So hopefully that exact thing is what will transpire. Dr. Gray, thank you so much for joining us this morning. We appreciate it.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.